So essentially, when I was looking for college degree programs, I knew that I wanted to be in an environment where I helped people. So I had considered nursing, I had considered medicine, and I came upon medical imaging and found it to be so fascinating because of all the technology that was used. So I found, a major where I could help people, which was my original intent, but really be using technology pretty freely, pretty frequently. And for me, that was very, very exciting.
So in the medical imaging lab at Misericordia, which is where we are now, we use the room for multiple classes, for an exposures class where we actually can take x-rays, and then for procedures lab where we do all the physical positioning. Twice I have been a mock patient. I did it in my freshman year for the upperclassmen, and that was very beneficial because I had prior exposure to what was happening before I actually got there. Then I did it again for the underclassmen, and that was beneficial because I could provide insight and help them a little bit and give them tips about how this will apply in the clinical setting.
Well, in our field, there's a lot to be excited about when you talk about the future. And I will often say to the students, as I'm teaching them about a particular, health problem or pathology that, 20 years ago, this was a death sentence. And now, with the advances in imaging, people have a much better outcome. So just to see how far our profession has gone and to be able to kind of impart that to the students, I think is really exciting.
Here at Misericordia, we believe in not only educating for the current, but also for the long term. And so some of those activities are getting them involved in giving a presentation at our local ultrasound society or attending the national annual meeting so that they can see what the profession is like beyond their 4 years and once they get engaged into it.
Our sonography program here gives our students a full 12 months, a full year of full-time clinical, which is 32 hours a week. You're not going to find really a lot of programs that offer that amount of clinical time. We prepare our students before they go out into clinical with scan time. They're not just going out into the clinical world not knowing how to scan what a transducer is and their anatomy they know. But they do get that full-time clinical experience for a year, which is an awesome experience. Myself as a faculty member and the clinical coordinator, I visit those students once a month minimally. So there is frequent communication. So if they ever have a problem, they can contact me. I visit the site to make sure that the student is progressing as they should. So we all communicate very well together.
What makes Misericordia really special is the fact that they give us a lot of opportunity to scan in lab, and they always want us to be in lab as much as we can. And they give a lot of clinic hours and opportunity, so we really have a lot of time and practice to learn our skill.